Yes, I think we can continue. I've sent out the link so people will be joining.
Yeah. So so going back, I was talking about my electives. So it's quite interesting because you get a chance to pick and choose wherever you want to go. So everyone in my cohort did different things, and then it's interesting because what I did was I did my electives in trauma surgery in South Africa because that's somewhere I would like to visit and experience the healthcare. So it was a good 6 weeks, visiting different parts of South Africa and experiencing the healthcare there. So I'm sure you guys would, have a chance to think about all this and then go for your electives. So, so generally, I had a good experience in Edinburgh itself. So, I can say that, IMU do prepare us very well for the clinical phase. When I started my year 4 in Edinburgh itself, I felt that the 7.5 OSCEs are much harder compared to the one in Edinburgh. So that's something that you have to worry less about. So I think last year I did a talk, back in IMU itself regarding Edinburgh itself, and I spoke to my program director, and he mentioned that the general comments that the students who transfer there are generally quite well prepared, and they do not really warrant any kind of extra work to be done, after finishing 7.5 before starting Edinburgh itself.
I think I can speak to the testament of that because I just finished year 4. So what Roger said is quite true that IMU prepared us relatively well for Edinburgh. So we will find that many times we are more prepared in terms of physical examination and history taking as compared to the locally trained students here. So they don't really have enough exposure to physical examination tutorials and teaching in their earlier years. So they only get it largely in year 4. Whereas compared to IMU students, we get it quite early on. So we tend to have more exposure and then we practice it a lot for OSCE. So this translates to our eventual skills when it comes to seeing our patients. Okay, Roger, back to you.
So if you have other further questions regarding my experience, you can always ask in the chat later on. But moving on, with regards to postgraduate prospects.
Sorry, you can't seem to change the slide, wait. But you can carry on.
Well, so there's different ways you can, the degree. So this degree is quite well recognized throughout the world. And in Malaysia, it's not going to be an issue, and in Singapore, it's not going to be an issue. In Australia, it's not going to be an issue. So, but I chose the path of staying in the UK itself because I felt that this is the best option for me currently, given the wide variety of prospects that I have in the UK, because it's such a huge country, and choosing a specialty, it's much easier than back in the Asian countries, and there's a wide variety of places that you can go if you are interested. So, I'm just going to talk about what I did first. So postgraduate prospects. So the first thing what you come out as after finishing your final year in medical school is, they call it, you join the foundation program, which is the FY1 or FY2. So this foundation program, it's a 4 months rotation over the 2 years, rotating in different specialties. Generally you'll be put in a wide variety of specialties, either two medical specialties or 1 surgical specialties. But some jobs allow you to do other interesting things like microbiology, clinical pathology, histopathology. So if you're interested in that, you can apply for those jobs. And then obviously, besides the foundation program, there's also the academic foundation program, where if students who are interested in research, can choose to go for it. So instead of so different schools in the UK. So Scotland is one of the big, like they call it the big school, and then there are different, and then UK, and then there's Wales as well, and then there's Northern Ireland as well. So I'm more well versed with the Scottish thing. So in Scotland, so what we do is when we apply for Scotland, so the first round of application is applying into Scotland. So there is a scoring system before you apply. So the scoring system, half of it is based on how well you do in medical school, and the second half of it is the SJTs, which is the situational judgment test. So you will get a score from that, and with that score, you apply to Scotland. Okay, so imagine applying to Scotland. So once you get into Scotland, you can apply to different parts of Scotland to work in. So you can apply to work in Edinburgh, you can apply to work in Glasgow, you can apply to work in Dundee, you can apply to work in Aberdeen. So that's the second round. And then within each city itself, there will be different jobs that you can apply for. So you'll be all listed up eventually. So there's a huge list of jobs you can apply for. And then based on what you're interested in, for example, someone is interested in orthopedics, you can apply for a job that has orthopedics in it. If someone is interested in cardiology, you can apply a job with cardiology in it. And then what I realized is Edinburgh, they do post you to different hospitals over the different 4 months. So, it depends on how you like, your lifestyle to be. Once you graduate, you can choose it, because certain jobs just allow you to stay in the same hospital for the whole year itself. Yeah. So as shown in the slides, it's a national recruitment, so it's quite a fair process, so there is no bias. So if you graduate from the UK itself, you are considered the same as everyone who graduated in the UK. So it doesn't mean it doesn't mean that if you're an international student, you're seen differently, but you are seen in the same level as everyone who graduated in the UK itself. That's what I like about the UK system. Yeah, so for 2 years, you get six 4 months, post. Generally, you get a very balanced experience. So the first year is more, you're trying to learn to be a doctor itself. And the second year, which I'm going to move to, you're taking out a more senior role, and, you're taking referrals, you're going to see patients itself. You're going to teach your junior doctors, which is the FY1 itself. And then what you get after working after the first year, it's the full registration. So this is good, because I think a lot of doctors, they go Australia to get jobs and stuff. So with the full registration, you're entitled to try and apply for a job in Australia itself. And then how they assess is quite similar to how we do in medical school. There is portfolios that we have to fill up, reflections that we have to do, skills that we have to do and get signed off itself. And then after the first 2 years, we do apply for, more specialized posts. So after the first 2 years, we get to apply. If you're interested in medicine, you can apply for this training path called the internal medicine pathway. And then for surgery, it's called a core surgical training. And then GP, there is another pathway. Radiology, there's another pathway. Anesthetics, medicine is also another pathway. So these are the things that you can consider after finishing your first 2 years as a doctor itself. Yeah, so I think that's the end of the talk. Any questions for me or Denise?
Guys, feel free to unmute yourselves and ask any questions, or just put them in the chat box.
Can we hear about Denise's experience?
Hi, who is this asking?
My name is Muqtadi.
Hey, nice to meet you, Muqtadi. What do you want to know about my experience? Any specific things?
No, I just want to get a feel of what Edinburgh is like.
Okay. So when I first came here to Edinburgh, it was quite a challenging time to adapt to things here because after all, the culture is very different from Malaysia. The people, they speak differently. So in terms of accent, there's some difficulty, especially when you talk to patients and as well as your cohort mates. So it takes some time to get used to. So I recommend you guys to maybe listen to more the BBC, the radio, and try to pick up the accent. Besides the accent, other problems that I also face are in terms of comm skills. But I think generally it's more of like an Asian thing as compared to the Westerners here. Because the Westerners they seem more fluent when it comes to taking history, taking or like breaking bad news or dealing with difficult encounters. But it's something that that we are able to brush up on with time and with practice as well. So there's a lot of opportunities for you to walk, to patients, to practice your comm skills. And there's also tutorials that they give during a clinical skills session that you can practice on. One other thing that we tend to face problem in is the resuscitation stations that will be tested in OSCE in year 4, which IMU doesn't go through. But along with that, there's also a lot of like clinical tutorials, and there's also senior teaching that we can go for, that we can practice our resource skills. Yeah, and other than that, I generally share the same sentiments, and I think Roger summed up the experiences quite well in terms of my short time here in year 4. Yeah, for exams wise, I think it's quite manageable in a sense because due to COVID, they changed it to an open book assessment, so that makes things a bit easier, I would say. And they have also changed the OSCE to an online OSCE program. So I think Edinburgh itself is very versatile when it comes to this kind of things. Like when COVID struck, they immediately set up a platform, an online platform, and then they did a week by week teaching and learning for us. So they put up a weekly timetable, and then every day we have daily lectures and tutorials with the consultants. And they're also quite big on the feedback system. So if any point in time you run into any problems, be it academic, social, or like just your general well-being, is quite okay for you to like give feedback. And you can also look for your professional mentors and your clinical tutors, which are always there to help. So yeah, I think I had a very good experience so far in Edinburgh. Does that answer your question?
Yes, thank you.
No worries.
There's a question in the chat box.
I saw it. Yeah, I mean, like, yeah, so, it depends, of course, depends on how much what's your group of friends, in IME itself. So obviously, we tend to keep in touch, with other, generally I tend to keep in touch with other IMU students. So, but being in Scotland itself, most of the friends that I keep in touch is the ones that are in Scotland, from Glasgow, Dundee, or Aberdeen. So we do visit, each other here and there, just to have meals together, and then to explore the different cities, And I mean, I can talk more about Scottish university itself with regards to I think in Dundee, what I remember them telling me is I think in the first year when they first transferred, they still get a lot of preclinical stuff, whereas Edinburgh, it's straight on into like clinical stuff itself. And what I heard about Dundee is that they get more teaching, so they get a lot of teaching with regards to all skills and all, whereas Edinburgh is more academic. We get a lot of like teaching with regards to research and stuff. And honestly, I think with regards to like organization itself, I think Edinburgh curriculum is quite well organized. Like I mentioned before, you guys will get when students will get to Edinburgh, will get to experience a full wide range of clinical stuff that we see. Whereas in I think other universities, they just get thrown into like general medicine, and then you just have to choose whether you do cardio, respi, GI and stuff. Whereas in Edinburgh, you get specific blocks for cardio, respi, and GI. So that's what I heard so far.
Yeah, I heard the same thing from my friends who are matched to Manchester, where like what Roger say, they depends on luck. They can either get assigned to like cardio, respi, GI, and neuro, so they won't get the whole slew of modules like what Edinburgh has. So they will also get example like 6 to 10 weeks of general medicine, whereas Edinburgh does a full year of general medicine. So you get exposed to you're really like well versed in general medicine, which is quite important as a future doctor, because even in the GP setting, you tend to see patients with these kind of diseases. These diseases tend to be more common. So I think it's a very vital experience that you can get if you choose Edinburgh.
No, I know everyone has sent like a list of questions to be answered. Have this talk answered most of the questions that you guys have asked?
Roger, Denise, I have a question. The person doesn't want their name to be told. So the question is, if everyone they know in Edinburgh had A's in their FPP.
In the what?
In their FPP. So before coming to Edinburgh, did they have A's? Because there is a stereotype going on that if you want to get into Edinburgh, you need to have an A.
Is that the STEM 3 exam?
Yeah, semester 3 exam. So the grades that get sent out to the PMS schools.
Well, I personally didn't get an A.
Okay. So I think that answers your question.
No, but I mean like during when I came, there wasn't all this system, where they rank their students and all. We just put in our choice and we just get selected or matched in a different school itself. I'm not sure how the exam system now is different. Because I was on the 114 batch.
I think for my batch, we are quite similar to your ME 119 system. So I would say Edinburgh looks for this B plus and above. B plus or B. It also largely depends on a bit of luck as well. It depends on how your batchmates choose and rank the schools.
So can I ask, how many spots are there currently?
Guys, I forgot. How many spots are there for Edinburgh? Can someone put it in the chat? I think there's like 9, right? If I'm not mistaken. 8. Yeah. Ranga says it's 8. So yeah.
Yeah, like I said, I'm not sure about how the whole selection system is like, because we didn't get, all of this, where they show us all the regular students, before. So Dennis should know more about how the matching system is currently.
They actually didn't show us anything, they just showed us how the schools rank us.
Oh, okay.
Yeah. But they didn't tell us like how they rank or like what grades did they use to rank.
Yeah, I don't think there is a specific grade that anyone has to get before getting a spot or something.
But I think Puan Rashida would have given you guys like a table where they show different emphasis and percentages on the different schools. So I think Edinburgh has a higher percentage on academic and IELTS, if I'm not wrong, for my batch at least.
So they no longer say what the universities require. So they just mention the fee, the IELTS score that you require to get in, along with how much the living cost gonna be. So it's changed since then.
Oh, so maybe it's different now. But for my batch, it was academic and IELTS. Quite similar to the rest of the Scottish schools.
Okay, guys, if you guys have any other questions, or else we'll probably have to call it an end. If you guys have any other questions for Roger as well.
Yeah, hi. I just have one more question to Roger.
Yeah.
You know how you said that Edinburgh emphasizes or is more revolved around academics? Do you think that
Yeah.
puts people who are opting for surgery at a disadvantage, or do you think it's better if they choose another university?
No, I mean, okay, so when I say academic, right, means, right, you see a lot of famous surgeons or professors there, who have done a lot of research, So obviously, with regards to surgery, it's more, it depends on what surgery you do or what medicine you do, anything that is competitive, always do require students, to put in more effort, to show that they're interested in a certain specialty, or to show that, they have done certain research, in certain specialty, and makes them, when it comes to that selection process, it makes them want to choose this student or this doctor itself. So being academic school itself, it gives you a wide, range of opportunities for you to, meet different surgeons who are quite well versed with regards to, research, and, you can learn from them and, even participate in their research in itself. So, being academic school itself, I think it's quite good. It doesn't really matter what specialty you're gonna do, but it just gives you more opportunities to meet professors or consultants with, like-minded people who do lots of research. So it's good that Edinburgh has all this out there for students to experience. Does that answer your question?
Yeah, pretty much. Thank you.
I mean, like scholarship or funding for international students. I mean, like, directly there is no. They're not going to fund your medical school. So the only thing that has out there is I don't know if you're from Singapore. There is this thing called the PEG program, where I think they fund about 50% of your final 2 years in medical school, but you have to go back to work. But besides that, you do get scholarship or funding for like research you do, or for electives that you go for, or sort of things. Yeah. So mainly it's research. You get research funding. Yeah. Other than that, I don't think there is funding for like your school fees itself. Sorry, I can't hear you. Okay, so with regards to exam, it's very different, because in IMU itself, it's very like preclinical exam. You do a lot of like anatomy, physiology, pathology. Whereas the exams in Edinburgh, it's more, because you're now post-clinical, like you're like clinical students now. So a lot of exams are more towards clinical questions. For example, you get a case, they will ask you about, what's the best line of investigation, what's the best management, what's the first line of management. So with regards to, clinical questions, you do have to base it on guidelines. So, we also study NHS guidelines alongside, medicine. So when it comes to answering some questions, we know how to answer them. So like what's the gold standard management and stuff. So it's quite different. And then OSCEs are a bit different because now they want you to, for example, like in final year, we had to do like a focus history and focus examination. I know, like, in IMU, we learn how to do like a full cardio examination, a full respiratory examination, a full GI or full neuro. But, when it comes, coming to clinical school itself, you need to learn how to do like a focus examination, doing what is relevant and not doing what is not relevant itself. So, when you say it's harder, it's hard to say, it's just different. And then so this FY1 post application, so Scotland, UK is everywhere. You can apply to anywhere in the United Kingdom. So even Wales, Northern Ireland, it's all up to you based on where you want to go. It's not just restricted to Scotland. Oh, I mean, like generally, I've lived there for throughout my medical school, and it's fine. I don't see how in any way that's unsafe so far. Because generally, as a medical student, we do live in like a street where it's quite busy. A lot of students live there. A lot of like doctors also live in that street itself. So I don't see anything that has issues with any security.
Guys, any other questions? If there are no more questions, we'll probably have to call it an end. Wait, all right. Yes, Jing?
So, okay, when you say compare Edinburgh and Glasgow, what do you mean? Like, in what sense? I mean, like, it's difficult because I'm not too sure about the curriculum in Glasgow, but like I mentioned, what I felt, in the Scottish University, Edinburgh, you do get the whole, variety of specialties that you get to go to, without having to compete, arranging yourself, yeah. And then support given to students learning. So like Denise had mentioned, we do get like a personal tutor, who checks up on you, depending on how regular he wants to regarding like your general well-being, your school stuff. And then, but what is good in Edinburgh is that we do get this how to say, usually get like a more senior doctor or like a registrar who, takes upon a more like closer relationship with like a few students, So sometimes you'll arrange OSCE practice, you'll arrange time for you to go, follow him on the wards, to see patients, just to get a more in-depth learning experience. But other than that, I'm not too sure about how the Glasgow curriculum is.
I think for Jing's question, if I'm not wrong, for the matching system, Edinburgh will still pick the students even if you don't achieve your IELTS yet. However, you will still have to attain the minimum IELTS requirement before they accept you for transfer. As for the deadlines, I'm not very sure. I have to ask Puan Rashida.
Yes, Denise. So basically, guys, if you don't meet your IELTS score, you will still have some time. So even after you get matched, they'll give you a certain deadline, so you can redo your IELTS within that time period. If there are no more questions, I think that's about it. Thank you so much, Denise and Roger. Thank you everyone who attended. Yeah, thank you for arranging everything. Thank you so much.
Okay, thank you everyone. If you have any more questions, you can just ask Omer for my WhatsApp number, so you can ask me questions directly from there. Thank you.
Thank you, Roger. Thank you, Denise.
Thank you, guys.
Okay.
Thank you, guys.